The supraspinatus, infraspinatus, teres minor, and subscapularis are known as the rotator cuff muscles. Together, they encompass and therefore stabilize the glenohumeral joint. All of the rotator cuff muscles are very accessible. The chunky supraspinatus is located in the supraspinous fossa, deep to the trapezius's upper fibers. Its belly runs underneath the acromion and attaches to the humerus's greater tubercle. I'm going to begin with the supraspinatus. There you can see that small rotator cuff muscle that sits right off the top of the shoulder. And probably the easiest way to get a handle on it is to find that spine of the scapula here that runs at an angle up toward the acromion. The supraspinatus belly right there. And as I follow it laterally, it gets a little thinner and a little more tendinous, and there it passes underneath the acromion to attach to that greater tubercle of the humerus here, deep to the deltoid. The flat, convergent belly of the infraspinatus is located in the infraspinous fossa. Most of its belly is superficial, with the medial portion deep to the trapezius and a lateral portion beneath the deltoid. The teres minor is a small muscle squeezed between the infraspinatus and teres major. It is located high in the axilla and can be challenging to grasp. Line of the scapula here, the medial border of the scapula here, there's the inferior angle, and then the lateral border of the scapula here. And if I set my fingers along these three landmarks, they sort of form a bit of a triangle. And that's where that infraspinatus belly is going to be before all the convergent fibers come this way to pass underneath the deltoid and attach at that greater tubercle of the humerus. There we can see a nice example of the infraspinatus right there, right in between those landmarks. Here we can see a bit of the teres major. Here's some of that posterior deltoid. And there we can see some of the fibers of the trapezius. Go ahead and relax. So I'm just going to set my fingers right in that triangle and roll across the fibers of the infraspinatus. This pathway is going to be two teres muscles, the teres major, and then just above it, the teres minor. Now the teres major is going to be much larger, as its name insinuates, and I can just get my fingers on that here, on my partner, and then I'm going to leave my fingers just above it and roll across the small teres minor. So the teres minor sits between the teres major and the infraspinatus. The deep subscapularis, located on the scapula's anterior surface, is sandwiched between the subscapular fossa and serratus anterior muscle, with only a small portion of its muscle belly accessible. And that's the Latissimus dorsi and the teres major. So instead of trying to sink my thumb through this tissue, I'm going to just put my thumb right here in front of it, and then very slowly, with my partner's breath, here is the Latissimus dorsi, part of that teres major, and I'm going to set my thumb right into that space. And then mobilizing the shoulder, I'm going to slowly sink my thumb into the axilla, just sort of following my partner's breath, because this is someone's armpit. It's a little tender.